As you get older, treatment for arthritis in the ankle and arthritis in feet may be required. The joint damage from this condition can cause swelling, pain, and physical changes in your feet and ankles. Joint degeneration is a common symptom of the many different types of arthritis. You gradually lose the smooth cartilage that acts as a cushioning inside of them. Because of this, your bones are constantly grinding and wearing against one another. It's also possible that the soft tissues in your joints will start to wear down. After a certain amount of time, the joint could become dysfunctional and stop moving in the correct manner. Because there are so many joints on each foot, your feet are a natural spot to notice the effects of arthritis. If you suffer from arthritis of the ankle or foot, you may notice that your feet hurt. The following are the foot and ankle joints that are most commonly affected by it. Your heel bone, your inner midfoot bone, and your outer midfoot bone all articulate with one another at these three joints. The joint that connects your big toe to the bone of your foot. The joint that connects your ankle bone to your shin bone. The symptoms of osteoarthritis of the ankle, most commonly referred to as ankle arthritis, as well as arthritis in the foot, often include a sensation of tenderness when the joint is touched, experiencing pain whenever you move your foot or ankle, movement, walking, or putting weight on your foot is difficult for you, pain, warmth, or swelling in the joints may be present. You report an increase in pain and swelling after you rest, such as when you sit or sleep. Cartilage is a specialized sort of connective tissue that covers the ends of bones and enables joints to move without friction. If the cartilage in the joint is injured or lost altogether, the joint may become inflammatory and misshapen. Treatment for arthritis the ankles and arthritis in the feet. You could be helped by one or more of the following therapies for your arthritis, depending on the symptoms you're experiencing and the underlying cause of your condition. Physiotherapy or massage. Injections of steroid medicine into the arthritic joints. Medications that reduce swelling, such as anti-inflammatory medicines. Pain remedies. Inserts in your shoes, such as pads or arch supports. Inserts for your shoes that offer support to both your ankle and foot, orthotics. Shoes that are made to order. Supportive devices such as canes or braces. Surgical treatment for arthritis of the foot and ankle. It is recommended that patients with ankle arthritis look into non-surgical treatment options first, wherever that is available, because there is some evidence that they are beneficial in reducing pain. Alterations to footwear, anti-inflammatory medication, and physiotherapy are all possible treatment options. If none of these treatments work, you might want to consider getting injections of corticosteroids to lubricate the joints in your feet and ankles. In cases where more conservative treatments are not successful in relieving the discomfort caused by foot and ankle arthritis, surgical intervention may be necessary. Your physician will recommend the course of treatment that is most appropriate for you. There are two distinct kinds of surgical procedures. Operation on the fusion of bones. This procedure is also known as arthrodesis. In this procedure, the bones are joined together using metal rods, pins, screws, or plates. After they have healed, the bones will continue to be connected together. Joint replacement surgery. This is often reserved for the most serious of cases. Your physician may refer to the procedure as an arthroplasty. They will remove any bone and cartilage that is broken and then replace it with either metal or plastic. The osteoarthritis of the foot and ankle can be identified and treated using a technique known as arthroscopy, which is a minimally invasive treatment, keyhole surgery. If arthroscopy is performed on the joint while the arthritic process is still in its early stages, the joint can be cleaned up. On the other hand, it has very little impact on curing the condition or reducing the severity of its symptoms. 2 or 3 very small incisions are made in the patient's ankle in order to accommodate the removal of small devices that are used to remove bone, cartilage, scar tissue, and inflammatory tissue. Sanding the joint cartilage is another option that the surgeon has. One of the most helpful things for people who suffer from ankle and foot arthritis is to invest in good footwear. Because if you suffer from arthritis, the shoes you wear are either going to help or hinder your condition. The proper fit of shoes has a significant impact on how comfortable they are to wear. Therefore, it is important to get your shoes professionally fitted and pay attention to the cushioning, shock absorption, arch support, and heel cups. People who suffer from severe osteoarthritis in their feet may find that wearing shoes with rocker soles, which have a sole that is thicker than usual and a heel that is bent, is very helpful. According to the results of some tests, there is a reduction of pressure that is equal to 12% under the big toe joint, while wearing shoes that had this type of sole. These soles are often found in footwear that is designed for athletic use. A recent study found that individuals with arthritis in the ankle or foot who wore rocker sole shoes experienced a 22-point reduction in the amount of pain they reported. Arthritis is a debilitating condition that can make even the simplest tasks difficult. If you're living with arthritis, you know how important it is to find the best treatment for arthritis in the ankle and arthritis in feet that works for you. This is why you must click the link below this video. Because with the right treatment, managing your foot and ankle arthritis doesn't have to be a challenge. So go on, click the link. You'll be glad you did.